Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will continue the pediatric ultrasound course and talking about the spine study. As you see, this is the probe we use in this exam. This is 9 linear, and there is a mild explanation of how can we do this exam. This is a baby. Will we expose his back and begin from down upward? We will put gel on the field of the spine, and we will use the 9 linear probe. First, we will use it longitudinally from down upward, as you see, then transverse from down upward. We will examine the spinal cord, conus medullaris, phylum terminal, and coda equina. 4 elements. We will comment on them. First, longitudinal and transverse from down upward. Now, this is a normal spinal cord. These 4 elements, we must know it. The spinal cord, this is the part upward, and this is the green one, is the conus medullaris. Then the phylum terminal, this is a fibral extension of the spine. And then coda equina, this is bundles of the intrauterine nerve roots. We must know these 4 elements and comment on it in the report. As you see, the spinal cord, this is black one, and this is an echogenic dot in the center is called central canal. Then there is phylum terminal. We can see the phylum terminal in the longitudinal image. And then the coda equina, this is a bundle of nerve roots. This is the down picture. This is coda equina. And if we go up, we can see the spinal cord with the central echogenic dot. And in the longitudinal image, you can see the cord and conus medullaris, and we can see the phylum terminal and coda equina. This is phylum terminal cyst or pilar cyst. It's a normal variant. We can see it. It's a well-defined small cyst in the phylum terminal, and we can measure it, and we may be associated with mild hydromyelia. Hydromyelia meaning the central canal, this is the echogenic dot. You can see it mildly dilated. It's a normal variant. Another lesion you can see, the spinal lipoma. It's an echogenic mass at lower part or lower end of the spinal canal, and we can measure it, and we can see the conus medullaris buried in it, and there is tethering of the cord, meaning lowering of the spinal cord. The normal spinal cord end at lumbar 1 vertebrae. In this level, the spinal cord is ended in the L1. If we can see the spinal cord is down, we can call it tethering of the cord or lowering of the cord. Here you see there is two spinal cords, or there is a split of the spinal cord longitudinally to two spinal cords. This is called diasteatomyelia. Another lesion, you can see it. There is maybe a spina bifida without any change outside, and it's accidentally or incidentally finding during X-ray or CT scan. There is posterior element defect in the spine without any sac bulging through it. It's the most common and least serious. There is a spina bifida occulta. You can see here there is defect in the sacrum and defect in the lumbar spine without any bulging of a sac. There is open spina bifida here, not occulta, it's open, meaning there is something bulging outside. This is called meningoceal or myelomeningeal according to its content. If there is only covering meninges and CSF only in the sac, it's called meningoceal. If there is spinal cord elements, it's called myelomeningeal, and it is a serious condition. Here you see ultrasound for a baby intrauterine. There is defect in the spine, and there is bulging of sac containing CSF, and maybe there is some spinal cord element. This is meningoceal or myelomeningeal. Also, there is ultrasound seeing defect in the spine and small sac bulging through it. Also here there is defect and there is element extending from the spine outside, maybe myelomeningeal. There is MR showing sac expanding from the spine posteriorly, and there is spinal cord element myelomeningeal. In another picture showing tethering of the cord, and there is a sac bulging outside from defect in the spine, meningeal or myelomeningeal. These are the most important lesions you can see through examine pediatric spine. And thank you.